Welcome, everyone. We're just giving a couple of more minutes for people to join, and we'll start our session. All right, so just to start with a few Zoom instructions, feel free to introduce yourself in the chat. You can add your name, your organization, your country. You can also share comments via the chat during the webinar, but also you can use the Q&A function at the bottom of your screen to ask questions. Or you can also interact by raising your hands. We'll then identify that you'd like to speak and we'll give you the floor. So just to warm up the room a little bit, we would like to know who we have today. So I'm going to launch a quick poll question. And we would like to know who is in the room today. We'd like to know your role. Do we have midwives, advocates, physicians, academic, or researchers? I'll give you a few seconds to complete, and then I will launch the results. Okay, so we mostly have midwives today, but we also have advocates and academic or researchers. Nice. You're all very welcome. So we're going to start today with the opening remarks from Jacqueline Dunkley-Bent, ICM's Chief Midwife, and Anita Gibson, the Director of AlignMNH. So I'll pass the floor to Jacqueline. Over to you, Jackie.
Thank you, Bruna, for such a warm opening. So delighted to join you all. As Bruna has said, I'm Jacqueline Dunkley-Bent, and I'm the Chief Midwife at the ICM. So every day, women's rights are challenged and continue to be challenged. I think we can all, I think that resonates with all of us in so many different ways. We're witnessing attempts to roll back hard-won progress and silence evidence-based care. But there's another story unfolding, one of courage, and you're a part of this. Every midwife and every stakeholder in this meeting, every advocate in this meeting, you're a part of this ripple effect. The story's unfolding for sure. The stories of courage, the stories of solidarity and resistance around the world, advocates, scientists, midwives, and their partners are uniting and fighting back. We are a part of that movement. There's no time like now. It's time, as I frequently say, to roll up our sleeves and not throw up our hands. In honor of International Women's Day 2026, we're proud to welcome you as champions, as allies, and partners in this movement. Today, we celebrate, a few days early, of course, International Women's Day, ahead of the main day. And we do so intentionally to shine a spotlight on the powerful partnership between midwives, and women's rights advocates. This partnership is not incidental, it's foundational. And in my career, the only time I've ever made any big, any huge inroads in relation to change is when I have been hand in hand with women's rights advocates. It lies at the heart of our midwifery philosophy and model of care. It drives our collective advocacy and it fuels our movement to centre women in health systems, in policy, and in society. This partnership is our strength. It's our strategy. And in the face of growing opposition around the world, we brand it as being our power. Before we look ahead to today's discussions, let us reflect just for a moment on how far we have come. 1 year ago, on International Women's Day, the ICM, International Confederation of Midwives, relaunched the Push campaign. Some of you may remember this well. So, relaunching the Push campaign as the global campaign for women-centered care, championing midwives as the pathway to achieve the right thing for women in the right place at the right time. From the beginning, we have understood that advocating for women-centered care and advocating for midwives are two sides of the same coin. I think this is a phrase I'm sure that's been coined by our lovely Marette. You cannot have one without the other. Two sides of the same coin. In this second phase of Push, we have focused on building powerful partnerships to fuel a global movement. We're reshaping public perception of midwives and the care they provide. And don't we need it? We need to influence public perception about who we are and what we do. We're increasing the visibility of midwifery among policymakers, and we're building momentum, stepping into spaces where decisions are made. And today, we gather not only to celebrate progress, but to reignite our collective fire to go further. And when we go together, we might not go fast, but we certainly go further. So, our first panel, let's hear about the panels. Our first panel reflects that progress in action. I can't wait to hear about that. We're honoured to have and to welcome 3 midwifery leaders from Ethiopia, Kenya, and Uganda, who will share the remarkable successes that they have achieved in advancing national advocacy for midwifery and midwives. Midwifery, the profession, and midwives. Their work emerged from the ICM's first regional advocacy incubator, which is a novel way of describing this piece of work. It suggests something of nurturing, maybe, growing, enabling, but it's an initiative designed to equip, connect, and elevate midwives as leaders of change. In October 2025, the Regional Advocacy Incubator brought together 6 midwives associations and their leaders, of course, their respective leaders from Ethiopia, Kenya, Malawi, Uganda, and Tanzania. Together, they exchanged knowledge, sharpened advocacy skills, strengthened partnerships with civil society, and refined strategies to implement and expand national advocacy plans. Participants described the incubator, and listen to this, I was quite taken by this expression, but the most powerful or more powerful than any manual, that this intervention was more powerful than any manual. And that speaks actually to many of us, all of you in the leadership space, because ICM believes that all midwives are leaders. A guideline, an evidence-based research, empirical evidence, if you will, and what these midwives from these countries said, that this intervention was more powerful than any manual. They highlighted the transformative impact of peer learning, shared regional experience, stronger civil society alliances, and increased visibility of midwives as leaders. Their progress will show in time what is possible when midwives are supported not only as providers of care, but as leaders. From Africa, we then shift to a truly global stage. One of the amazing benefits and privileges, I think, of working at a global level. This rich diversity that seeks to unite us and join our midwifery DNA. Our second panel brings together push partners from the Americas, the Eastern Mediterranean, and Europe. Across regions, they're mobilizing communities, influencing decision makers, and amplifying the evidence that midwives and women-centered care, if you will, saves lives and strengthens societies. Let's not forget, lest we forget, $1 invested in midwives yields a 16-fold return on investment. Their work of midwives, their work reminds us that PUSH is not owned by one organisation. It is not confined to one region. It is a growing global movement that I think we're all proud to be a part of. And we meet at a pivotal moment. A pivotal moment. Women and newborns are vulnerable. Just look across the world and all the challenges that we're facing. So we're meeting at a pivotal moment. Millions of women, girls, and gender diverse people still lack access to care that respects their autonomy, their human right, their dignity. At the same time, the world faces a shortage of 1 million midwives. This can be prorated across your country, but collectively, we need 1 million midwives. So it's the world's problem, but it's your problem as well, because this will impact on every country, particularly with social and economic migration. Professionals who, and we know this, I love mentioning this, could meet more than 90% of essential sexual, reproductive, maternal, newborn, and adolescent health needs. It's like having the vaccine to COVID and nobody paying attention to it, or very few. We have much to do in this space. We have the vaccine, we have the solution. The solution is not abstract, it is within reach. We cannot and must not accept the failures of the status quo as being inevitable. I mentioned it's not time to throw up our hands. It's time to roll up our sleeves. We cannot normalize preventable deaths, the majority of which take place in sub-Saharan Africa. A stillbirth every 16 seconds. A woman dying around the time of childbirth every 2 minutes. Preventable death from postpartum hemorrhage, where in some parts of the world, if you're dying from postpartum hemorrhage, it's because you've got a severe comorbidity and you've developed a severe intravascular coagulation, disseminated intravascular coagulation. So let's just be mindful of that. We cannot normalize preventable deaths, preventable suffering, preventable injustice. We know what works. We have the vaccine. We have the formula to put things right. We know, don't we know who delivers it, who provides it? And we know that when midwives are empowered, communities thrive. So today, as we mark ahead of time, that's midwives, we are ahead of time. We mark International Women's Day. Let us not gather simply to celebrate. We need to recommit. We need to strengthen our courage, put our best foot forward, think about progress, be inspired, encourage each other, and let's leave this space even, pardon the pun, ready to push for those of you that are pregnant right now. No pushing at the moment, but pushing metaphorically, push the campaign for rights for women and for midwives. Thank you. Thank you for standing with us. We can't do it without you. We can go far together. You know, the old African proverb, we can go fast alone, but we can go further together. The movement is growing and the momentum is building, and together we can. So thank you very much. You're in for a really exciting time listening to real experts who are doing the job on the front line at strategic level and in country at country level campaigning. So that's the opening, that's the introduction. I'm delighted now, delighted to introduce and hand over the baton to Anita Gibson. Anita is the director of AlignMNH, and she will be sharing her opening remarks. Over to you, Anita.
Thanks so much, Jacqueline, for the kind introduction. And yes, to everything that Jacqueline just said. So I'll keep my remarks quite brief. Just good day, everyone, and happy Holi to those who might be celebrating today. On behalf of AlignMNH, I am just so delighted to join all of you in celebrating an early International Women's Day and the 1 year of the PUSH campaign. I mean, congratulations, honestly, congratulations to ICM and the many midwives, advocates, and partners who have helped make the PUSH campaign a force for change. I mean, it's so exciting to actually see you all introducing yourself in the chat. It's really kind of seeing the names from all over the world is so encouraging. As Jacqueline mentioned, we meet at such a pivotal time for maternal and newborn health, given the unprecedented disruptions, particularly in the last year, and the shrinking fiscal space in which we're all working. We are challenged now more than ever to prioritize and make sound investments. And as we just heard, midwives are so central to these priorities and investments. I mean, simply put, I know those of us at AlignMNH and many of our partners, we know investing in midwives is one of the most effective strategies we have to improve maternal and newborn health outcomes. But investment alone isn't enough. As we all know, as the PUSH campaign reflects, progress depends on partnership. So I wanted to talk about that for a moment, because for those of you who might not be familiar with AlignMNH, we're in the business of partnership and connection, really fostering collaboration and creating moments for sharing learning and honest conversations. AlignMNH is a learning platform bringing together the latest science, evidence, and nurturing collective action to accelerate progress for maternal and newborn health and prevention of stillbirths. So we're really pleased to be part of the event today. And as some of you might know, we're currently building momentum toward our flagship event, the International Maternal Newborn Health Conference, or the IMNHC, coming up in just a few short weeks in Nairobi, Kenya. And IMNHC 2026 will be such a critical opportunity for a multidisciplinary community of governments, providers, researchers, civil society, advocates. You know, we have our multilateral friends, our donors and partners to all to come together. We plan to review the latest data, show the latest evidence, particularly practice-based evidence from real-world implementation. As many of you are there on the front line, you know there are just certain realities on the ground that need to be navigated. We want to highlight country leadership and bright spots and promising practices, and also kind of debate on what are the real practical solutions to change. I'm really excited to let you all know that the program will include a number of sessions highlighting the important role of midwives and share a number of practical, promising learnings from a number of countries. So I'm really excited to hear about the panels today, and I think this sounds like a really nice kind of continuation of the conversations that'll take place today. And I'm really hopeful that the energy, experiences showcased here today will really help motivate our community to arrive at the IMNHC in just a few short weeks. United, ambitious, ready for collective action. We really view the IMNHC as not just a moment, but really part of a broader movement, and really look forward for opportunities for collaboration with many and all of you to ensure that the movement continues and that we move forward together. Thanks so much, and I'm really looking forward to these panels. Over to you.
Thank you so much, Jacqueline and Anita. Now I'd like to give an overview of the agenda as mentioned by Jacqueline. First, we'll have the first panel spotlighting the Regional Advocacy Incubator. We'll hear from midwives from Africa. And in the second panel, we'll hear from Push Champions from the Push campaign. And we'll have speakers from different regions. So we are very excited to hear from you, and I'll pass it to Neha.
Thank you, Bruna. Thank you so much. Today, we're really excited to spotlight the Regional Advocacy Incubator, which was hosted by ICM in October 2025, as Jacqueline mentioned. So you learned a bit about this incubator already, but since it happened, we've seen really meaningful progress from these associations. We've seen that they're engaging more strategically with ministries of health, they're building stronger coalitions with gender equality and SRHR partners, and they're using evidence to advocate for midwifery-led models of care. And importantly, they're elevating their role as midwives and as associations, not only as service providers, but also as policy actors and champions of rights-based care. So today we will hear directly from them, from the associations, about what they've learned, the wins they've achieved, and how they're continuing to push towards national advocacy agendas in their countries. We have representatives from three of our associations here today. So we have Tanane Tilnasa from MWA, Atsani Yunus from Midwives Association of Kenya, and Sarah Namyalo from the Uganda Private Midwives Association. After they share their presentations, you will have an opportunity to ask them questions. So you can put the questions, as Bruna mentioned, in the box and in the chat. And we will start with Tanane Work from MWA. So over to you.
Thank you, Neha, for the invitation. Let me share my screen and share my experience. Is that visible now?
Yes.
Thank you so much. I am Tananyor from Ethiopia Midwife Association. Today, I will present the brief advocacy of Ethiopia Midwife Association about midwifery model of care. So first, let me give you some highlights about the national context, about the association and our advocacy goal. So Ethiopia Midwife Association was established in 1992 and it became a member of ICM in 1993. And midwifery education is offered in around 42 higher institutions, starting from diploma level and BSc and MSc in addition to PhD level. So there are two universities that offer PhD programs in midwifery and women health. In total, in Ethiopia, there are around 27,000 midwives, and among these, around 10,000 were active member of Ethiopia Midwife Association. In Ethiopia, there is a shared model of care is implemented. So these models affect the women experience during the pre-pregnancy, during childbirth, and during postnatal period. So the midwifery model of care ensure the well-coordinated and a high quality of care. There are a challenge that shifting from the shared model of care to midwifery model of care regarding the policymakers and other stakeholders may hesitate to adopt it. So strong advocacy is critical to build and support system level implementation. So our advocacy goal is to advocate for the adoption and the implementation of midwifery model of care, one of the innovation for sexual and reproductive health. So after the incubator at October, we implement 3 interventions. We can say the activities. Actually, the midwifery model of care were initiated on 2024. It is initiation by the Ethiopia Midwife Association with collaborate with Federal Ministry of Health. So after that, after the incubator, we implement 3 major activities. So the first one was finalizing this midwifery model of care documents. After that, we'll do the advocate of the midwifery model of care for the governments, the partner and funder in order to buy it for this implementation, for technical and financial support. And the third activity is the promotion of the midwifery model of care for the other healthcare stakeholders, for the midwives, and for other health professionals through different platforms, either with the webinar or the workshop. So this picture clearly shows one of our workshops that are conducted in Addis Ababa. So our stakeholders and the partners where there are, the stakeholders where the first one was the Ministry of Health. There are 3 officers that are related with the maternal health, the reproductive health officers. We had also professional associations that are the surgery officers. This includes the obstetrical and gynecologist. In addition to that, there are emergency surgeries. So these are one of our stakeholders during the implementation of this midwifery model of care. The other stakeholders were Debre Berhan University and Debre Berhan hospitals. Actually, this midwifery model of care is implemented as a pilot in Debre Berhan hospitals in 3 facilities, in Debre Berhan hospitals and 2 health posts. The other one was the executive board members of the association, and the midwives were our stakeholders, and there are different partners that are incorporated during the implementation of this midwifery model of care. So this picture clearly shows the site visit at Debre Berhan hospitals. There are different stakeholders here, and from Ministry of Health, from professional associations, and from academia. Finally, when you see the impact in the progress toward our goals, there are the final midwifery model of care protocol was developed. The second is the MIMOC advocate to the stakeholders, advocacy on the protocol in the visit MIMOC implementation health facilities. We visited health facilities that implement the midwifery model of care at Debre Berhan town. There are also workshops and webinars in order to create awareness for the midwives and other stakeholders in order to demand and implement effectively about the midwife model of care. The following results were fetched as a result. The first one was paved the way of Ethiopia to have an opportunity, the approved midwifery model of care protocol for the national implementation. And the key stakeholders demonstrate increased knowledge on the midwifery model of care. These are relevant and beneficial for sexual and reproductive health that leads for the implementation. And at the end, the midwives and the other stakeholders were become knowledgeable about the demand and how can we implement the midwifery model of care at their health facilities. So these are all about our advocacy in Ethiopia Midwife Association. Looking forward to your suggestions and the questions. Thank you.
Thank you so much. Thank you, Tananu. Really enjoyed the presentation. Always really great to see the really powerful advocacy that EMWA is doing in country to bring midwives to the forefront. So any questions, please do put them in the chat for EMWA, and we will move on to Eunice from the Midwives Association of Kenya. Over to you, Eunice.
Thank you. Thank you so much, Neha, and all the colleagues that have joined today's presentation to celebrate the International Women's Day. And from Midwives Association of Kenya, we say an early, happy International Women's Day. So my name is Eunice Atsali from Midwives Association of Kenya, and I would like to share what we've been doing since we began the push campaign in our country. And briefly, I'll speak about the national context and our association advocacy goal. So Midwives Association of Kenya was established in 2016 and is a full member of ICM. Current membership is about 1,100 members. And maybe a small context or a short context about Kenya. So in Kenya, we have midwives, nurses who start as nursing, then eventually graduate as nurse midwives, a combination. Then we have midwives who graduate with midwifery alone. And then there are those who start at diploma level as nurses and midwifery together. Then they eventually do a degree where they get midwifery at bachelor's level. But majority of nursing and midwifery professions in our country are, of course, nurses, a mixture of both nursing and midwifery and nurses majorly. So of all these, we have a total, normally we have a council, a central council, which is Nursing Council of Kenya. And in the Nursing Council, a total registered nursing and midwifery profession is about 112,562. However, of these, midwives are only 1% of this particular workforce. And therefore, there's a big need to have professionals that have midwifery. And as you heard from Professor Jackie, is midwifery could be the vaccine that we require to, of course, reduce maternal mortality, actually avert completely. So the goal for our push campaign in our country was to advance the adoption and integration of midwifery model of care as a standard of care for women within our country. So what did we do? Firstly, we had the first ever push campaign in our country where we had members from ICM who came to, to support us and also to help us develop a work plan. And this picture on the right actually shows that particular initiative, which was done in Kenya, which brought together about five midwives associations from different countries. So from there, we took it upon ourselves to do a 3-day technical workshop where we drafted a midwifery model of care policy brief. So that policy brief formed a basis for us to start knocking some of the doors. And before that, we had to do a workshop with our national elected officials, representatives from different counties, so that we briefed them what midwifery model of care is all about. And this was also to help them align to the advocacy direction that we had started. We had also national stakeholder briefing where we brought together different partners, Ministry of Health, we had regulatory body, we had our development partners who came, we all came together and we were able to share the midwifery model of care policy brief. And of course, we had some inputs from the team. We also had some midwives who are already doing their own private practice, and they shared their the challenges they're having and also what has helped them progress in their different corners. During this period also, we did an MOA, Memorandum of Understanding, with a media influencer. And the media influencer in our country has a following of about 1.6 million followers. And has so many posts. She is very active, especially in maternal issues, maternal and newborn issues. So this time round, what we are doing is invest in midwives. And I'm happy to say that yesterday we had our first ever live Instagram
where we had many people participating in, and of course several feedbacks thereafter. So we have begun the movement in the country. Some of our stakeholders and partners that we are looking at to support us, of course, we have media and social media influencers from different walks, from televisions, social media influencers, local country radio stations, because we have vernacular languages in our country. So it's very important to engage also in local languages. Then we have also civil society, grassroots advocates, and non-governmental organizations that are also supporting us, and we are looking at them to support us in advocating for invest in midwives and increase the numbers of midwives in our country from 1%, at least let's get to 20%. Then we have academia, technical partners, and UN agencies who are very actively involved with us, and looking forward that the partnership will continue. Then we have private sector and potential partners like Ferrings Pharmaceutical, Philips Pharma Groups, and Viatris, among others. And of course, the Ministry of Health becomes the number one partner, because for us to implement in the health system, we need the Ministry of Health as the major number one partner. So what is the impact and progress towards the goal? So firstly is the development of midwifery model of care policy brief, which will drive other agendas, for example, development of standards and guidelines for midwifery model of care, which is underway. And the brief will be the one to be able to help us to navigate, especially the Ministry of Health, so that they can see the importance of having midwifery model of care as part of the overarching health policies. Social media visibility through campaigns, I think that's something we have started, and we are moving with a hashtag Invest in Midwives. So if you follow that, I think you'll be able to see several campaigns that we've been doing, and we are to do it even throughout the year. And then we are going to be doing quarterly awareness of midwifery model of care across the country through webinars. And we will also ride on the MPDSR that have just been launched recently, MPDSR guidelines and committees, so that we can also, show that midwifery model of care is actually the vaccine for the maternal and perinatal deaths within this country. And we hope to continue sustained engagement with the senior ministry officials and legislators, because legislators are the ones that will drive, especially the budgets towards midwifery model of care, and of course also the policies within the counties. So thank you so much, and I believe midwifery model of care is actually the vaccine for maternal and perinatal deaths. Thank you very much. Let's continue investing in midwives. Thank you.
Thank you so much, Eunice, for that really wonderful presentation. I'm sure everyone really enjoyed it. Also, some really great innovative strategies in there, especially about using an influencer with a really wide reach to get the work of midwives out. So any questions for Eunice, please do put them in here and she will get to them. We will move on to the Uganda Private Midwives Association, and we will hear from Sarah. But before we hear from Sarah, we're going to watch a small video about her really powerful work that she does in advocacy in her country. So over to the video, please.
My name is Sarah. I've been a midwife for 20 years. You might not like what I'm about to say, but it's my job to talk about it. As a health worker, I've been exposed to too many preventable tragedies, and for too long, I've kept silent about Uganda's crisis of unsafe abortion. Criminalizing abortion doesn't make it less likely. It makes it more deadly. An estimated 800 abortions are carried out in Uganda every day. These statistics are far higher than the regional average. In Uganda, over 1,500 women die every year from unsafe abortions. Uganda is facing about double the burden of death from unsafe abortion compared to the rest of the continent. And for every woman who dies unnecessarily, many more are severely and sometimes permanently sickened or disabled. So when denied access to safe abortion, women resort to dangerous measures. Faced with post-abortion complications, men are even denied treatment by healthcare providers. But every woman has the right to health care, whether or not she has had an abortion. Don't you think it's time to put women's lives ahead of fear and stigma? One of the best ways to prevent unsafe abortion is by improving access.
Thank you. Sarah, you can share your screen now.
I think we are still seeing the video. I don't know. My screen is not displayed. Is the video still on?
No, do you need help with your presentation? We can also share it our side.
Yes, I'm trying to share, but it is covered with something else.
Maybe Bruna can share your
I don't know what
presentation.
is actually happening because.
Okay.
Yes, you can share
You sorted.
because it is covered with something which I don't understand.
Yes, no worries. We can support sharing the
Yes.
presentation. Marat, perhaps you
Yes.
can share the presentation?
Yes, she's trying to share on my behalf. My name is Sarah Namial. I'm a midwife presenting this advocacy work on behalf of the Uganda Private Midwives Association. There is another version of this slide. Neha, you are sharing the old version.
I think Marat, do you have the latest version of Sarah's presentation?
What is happening? All right. Yes, Sarah Namia from the Uganda Private Midwives Association. I'm presenting this work on behalf of the association. Uganda Private Midwives Association was established in 1948. Those are 76 years ago by retired midwives who felt that they were not tired and they were still required. Back to our advocacy work, the national context and association advocacy goals, we are focusing on abortion. So an estimated 297,000 abortions are performed each year in Uganda. Of these, 148,500 result into complications. In Uganda, abortion complications are responsible for 33% of maternal mortality figures in Uganda. So our advocacy goal and centered abortion care in the Greater Masaka districts. The intervention for this advocacy included, we organized a two-day advocacy meeting for 18 private midwives from the Greater Masaka districts. And the primary aim of this meeting was to raise awareness regarding improving access to abortion care, as we have many factors regarding, abortion care in Uganda. So participants engaged in discussions to identify effective strategies for the provision of woman-centered abortion care in their midwifery birth centers. We had stakeholders in this meeting, and we got a representative from the Human Rights Awareness Forum, which is a civil society organization in Uganda, actually working towards the work of abortion. The advocate updated on the legal framework of abortion, emphasizing key healthcare issues. Other stakeholders presented on medical abortion techniques, discussing best practices for safety and effectiveness of abortion care. We also had other stakeholders, which included the Assistant Masaka City Health Officer, who actually emphasized the need to address abortion as a key factor in maternal health care in our country. What is the impact and progress towards these goals? When you look at these figures in Uganda, we have around 800 unsafe abortions, which occur on daily basis, and these lead to 1,500 deaths annually and 148 abortion complications. So the progress towards this goal in the Greater Masaka district, this is what we have done so far. We had an advocacy meetings on abortion care, which was done, and the participants attended were 18 private midwives, and we wish to scale up to other districts, but this is still pending if we get funding. So we are also thinking of training of healthcare providers on woman-centered abortion care, because as we provide these services, we need these healthcare providers to be trained on maybe evacuation methods like manual vaginal aspiration and other uterine evacuation methods. We also did integration of abortion services into primary health care. This is in progress, where private midwives are integrating these services into their daily work. Community sensitization is also paramount, where we need to orient the communities on the dangers of unsafe abortion. We've not done yet. We have not done this yet, but it is pending. We also thought of expanding service delivery through task shifting, and this is in progress. As we trained the 18 private midwives, they went back and also did on-job training to the fellow workers. Another issue regarding abortion is combating stigma with education and respectful care. This is also in progress as we receive these women who receive abortion care in midwifery birth centers. And also, finally, improving access to contraceptive services is also in progress, as it is one way to go to reduce unwanted pregnancies, which lead to unsafe abortions in our country. Thank you so much for listening. This is what we had for you today.
Thank you so much, Sarah, for your really powerful advocacy and for taking the rights-based approach. I hand it back to move on to the next panel.
Thank you so much, Neha, and to all of our amazing speakers from the first panel. My name is Mirat Khalil. I work as the Push campaign lead. Similar to Anita, who congratulated all on Happy Holi this week, I also want to extend a very blessed Ramadan Mubarak and Lent to all. In the interest of time and those joining around fasting time, I think we'll move to our next panel, and from there we'll take the questions after that. So let me pass it to our first speaker, Ru'a Al-Tawili, who's representing the Arab Regional Midwifery Advisory Group, joining us from Saudi Arabia, the Emro region. Over to you, Ru'a.
Hello, everyone. Let me share my screen, please. Yeah, you can see my screen. Yeah.
Perfectly. Go ahead.
Okay, so I'm Roal Tawili. I'm a consultant midwife from Saudi Arabia and a member of the Arab Regional Midwifery Group. We are here to advisory group. We're here to celebrate with everyone the International Women's Day and to talk about our success story in the Arab region. So UNFPA Arab State Regional Office created the Arab Regional Midwifery Advisory Group as a voluntary group and specific mechanism for midwifery leaders from the Arab State region. First, to connect and advocate and engage to accelerate and scale up commitment to midwifery models of care across the Arab state. Secondly, response to the needs of regional technical experts to support the development and implementation of national midwifery strategies. And finally, is to develop the midwife leadership potential in the region. So 10 midwives were selected to be part of the initial ARMIG, or the Arab Regional Midwifery Advisory Group, based on the selection process led by UNFPA ASRO in July 2024. So in 2025, the UNFPA Regional Office and ICM PUSH entered into partnership to promote midwifery in the region, and the ARMIG were involved to guide the initial phase of the campaign. So in many countries across the Arab state, poor health literacy, strict gender norms permeate social, cultural, economic, and health system alike. Another major challenge is the lack of public knowledge and awareness about women's right to respectful women-centered care and the comprehensive and high-quality sexual, reproductive, maternal, neonate health services that midwives have the competency to provide. In other countries, there continues to be misconception of midwives as a lower class cadre or a provider of last resort, and the scope of practice for midwives across the Arab state region is often limited. So what did we want to address? We wanted to increase the awareness about the right to respectful women-centered care, advocate for every woman right to women-centered care among key audience, and finally to showcase the role of midwives in providing women-centered care. So how will we achieve this? The PUSH campaign, UNFPA and the Arab Regional Midwifery Group held a discussion about the regionalization of the PUSH campaign and discussed that in the initial phases. The focus needed to be on the raising awareness of women-centered care and raising awareness on what midwife can do and how midwife is best positioned to provide women-centered care. ARMIG members helped to inform the selection of key influencers, stakeholders for the virtual expert consultations. Facilitated consultation were held in September 2025, and then feedback influenced the initial launch of the campaign and the subsequent phases planned for 2026. So, do you remember this campaign? Or maybe you have passed through the social media and see this campaign in English. So this is the campaign. Resources were translated to Arabic and visuals from the region were used. A few social influencers from the region were tagged on posts and as UNFPA and ASRO and ICM in order to maximize outreach and engagement. So the result was over 500,000 of people reached through the 5 posts. In summary, the result shows that partnership between multiple actors, the ARMIG, UNFPA, Regional Office, PUSH campaign, and ICM helped to expand the reach of a campaign that aims to focus in its initial phases on the key objective of raising awareness of women-centered care and promoting midwives as the best positioned providers to deliver that care. In 2026, we hope that the ARMIC will take an even more active role to advise and support the continued rollout of the regional campaign. So this is the final slide. القابلات يهتممن بحقوقك وخياراتك وصحتك. So this is my presentation, and thank you everyone in the ARMEG group and for ICM to give us the opportunity to present this presentation. Thank you very much.
Thank you very much, Ru'a. Really a very inspiring overview of the work that you've done in the region. I missed fully introducing myself to the team here, but greetings from Cairo. So really, this campaign is very close to my heart and in my region. I'm very, very proud to see the assets of the Push campaign and the work that multiple advocates in our region are coming together to really change the narrative about who midwives are, what is the work that they're doing, and for us to reach upward of 500,000 people with just 5 posts because of this powerful partnership between midwives and civil society and community groups and advocates is very inspiring. So thank you again for presenting this work. Now, as introduced by Jacqueline in her opening, the second panel is very fun in that we will travel around the globe together as we celebrate many holidays and many cultures and regions and really the full power of this global movement. So from the Eastern Mediterranean region, we will shift to our northern neighbors in the European region. I would now like to pass the floor to Isabel Ferreira from APEO, the Association of Portuguese Midwives. Isabel, the floor is yours for your presentation.
Okay, thank you so much. So, greetings from Portugal. I will share my screen. Okay. So, greetings from Portugal. Greetings to all of you. It's an honor to be here. I'm grateful for the invitation and the opportunity to share with you how Portugal mobilized the push movement at a critical moment for women's health care. So I'm just going, yeah, like this. So Portugal is a small but wonderful country on the western edge of Europe. I live in Porto, as you can see it's in the north, as you can see in the picture on the right side. And in June, we look forward to welcome you all in Lisbon for another vibrant city from the south of Portugal in ICM Triennial Congress in 2026. We are working hard to make it truly an unforgettable event, and I hope you will all be there so that we can give a big hug. So in Portugal, midwifery is a postgraduate specialization within nursing. To become a midwife, one must complete a 4-year university degree in nursing, followed by at least 2 years of clinical practice and then 2 years of master's degree to finally become nurse midwife. Although midwives' professional autonomy is legally recognized, women's health care remains largely biomedical, hierarchical in practice, and the full scope of midwives' competencies is still not fully utilized. So, why push was urgent in Portugal? So in recent years, Portugal has faced significant instability in women's health services. There has been temporary closures of maternity units due to workforce shortages, mainly of obstetrician and pediatricians, not midwives. Over-medicalization, high rates of inductions, C-sections, and also instrumental birth. And also women being uncertain about where they would give birth because of temporary closure of several maternities, mainly in holiday time, which is very sad. And what began as a service issue quickly became women's rights issue. So public debate intensified, media coverage increases, and women began asking difficult and necessary questions about safety, dignity, and access of care. So because the Portuguese Midwifery Association strongly identifies with PUSH campaign, we decided to integrate them into our national advocacy strategy to protect women's rights and promote evidence care and strengthen midwifery's autonomy. So how did we do that? So one of our key decisions was to take advocacy into the public space. So We organize podcasts, live podcasts called Push Midwives Portugal through a partnership with FNAC. It's a national cultural, retail, electronic and book chain with stores across the country. These stores include public stages where cultural events usually take place. And so this allowed us to record our podcast for free and also benefits from FNAC promotional platforms. At the same time, we are open conversations and partnerships with women's rights associations, creating so that we could discuss all the things that will happen in Portugal and make joint reports. We also invited women's representatives to participate in our annual congresses and scientific congresses, creating shared spaces for dialogue. And for the first time, many women had the possibility to hear midwives speak publicly about continuity of care, respectful birth, evidence-based practice, and importantly, women spoke too. So main thing. So we also engaged directly with media and policymakers. We spoke with national television networks, newspapers and magazines, and request meetings with policymakers to discuss women's health needs and the role of midwifery. We were in these last years 2 times in the parliament discussing midwifery issues. We issued a positionment statement and highlighted that workforce shortages are not only staffing problems, but structural underinvestment in midwifery. This is the main problem here in Portugal, we think. And our advocacy was supported by scientific evidence, ICM international standards, and data from Midwives Data Hub. So we're very grateful for this partnership with ICM as well. So gradually, midwives have been increasingly recognized in the media as autonomous experts rather than secondary actors in maternity care and women's care in general, although, well, there is still a long way to go. So this advocacy is beginning to generate important changes. There are pilot projects for midwifery-led units being proposed in Portugal, both in public and private health care centers. Unfortunately, still propositions, but the politicians are more interested in hearing about this, and we see this in public discussion and political discussions. Discussions also started with insurance companies about expanding coverage for midwifery services. We did this as well. And across the country, new initiatives for autonomous midwife-led prenatal care are emerging, not only in public, so free healthcare, but also private health systems. We are also seeing a gradual increase of independent midwives and midwife-attended home births, currently mainly in the private sector. So these developments show that aligning national advocacy with global movement can really shift systems. So Portugal experience shows that when midwives organize strategically, communicate clearly, and build alliance, we shift narratives, we influence systems, and we advance women's rights. That's the main thing. So we finalize with this investing in midwife is not only a workforce strategy, it is a commitment to dignity, safety, and rights in childbirth. So thank you so much. See you all next year in Portugal for a big group hug in ICM Triennial Congress 2026 in Lisbon. Big hug.
Thank you very, very much, Isabel. If you can go one slide before. I was touched by many things that you had presented, but especially 2 things. Number 1, maybe 3 things. The first thing, the urgency around pushing in Portugal. And I think so many of us resonate with this urgency as well, that for us, it is a matter of life and death. It is a matter of my friend, my cousin, my sister is going to the hospital and is very likely not going to have a respectful, empowering, rights-based experience. For us, it's real. It's not just advocacy on paper. So I really appreciate you reminding us of why we're doing this work and the urgency that you said there. The second, I love the creativity and the idea, the innovation of the podcast idea. So looking forward to hearing more about this. Colleagues who are joining us for Congress, keep an eye out. And last but not least, I love this closing slide, the power of organizing strategically, building alliances, communicating clearly, shifting narratives, and influencing systems. This is the core of the PUSH campaign. And really, Isabel, you took the words from me. So really, I appreciate you giving us this very strong closing and inspiring all of us to reflect about this powerful partnership, the reason we have the PUSH campaign, this community, the alliance between midwives, advocates, researchers, other healthcare professionals to really push us forward as we're pushing for rights, as we're pushing for women, and as we're pushing for midwives. All of these come together. So thank you again, Isabel from Portugal. Now we shift to our
And thank
final
you,
speaker.
ICM.
Thank you, thank you. Now we will shift to our final speaker of this panel. We will travel from Europe all the way to the Americas. So, Ana Barreto, I am very happy to have you with us representing Libera. And I believe you will tell us the story of Libera, how this came to be, why you want to be part of the PUSH campaign, and some of the stories of the advocacy and impact that you are driving in the Latin American and Caribbean region. Over to you, Ana Barreto.
Thank you so much. Good morning, good afternoon, everyone. Buenos dias, bom dia. It is an honor to be here celebrating the International Women's Day and one more year of the PUSH campaign, which is a campaign that is so close to my heart and that reminds us that progress is always due to constant collective push. As we continue to push forward together, even in context of polycrisis, of increasing inequalities and conflict, because we center the communities that we serve. I am Ana Barreto. I am a proud champion of the PUSH campaign, and I am the founding president of Libera. We are a Global South-led organization that carries forward the legacy of Planned Parenthood Global. And our mission is to advance a model of power that is rooted in what we call reproductive dignity, where autonomy, sovereignty, and collective well-being are inseparable. At Libera, we connect health, justice, liberating narrative, and strategic advocacy. We build collective power and we advance the strategies that move communities from criminalization to reproductive dignity. And we achieve this by amplifying historically marginalized voices, co-creating solutions, and fostering collective action to reimagine what justice looks like in Africa and in Latin America. Our framework of reproductive dignity is informed by indigenous knowledge and the concept of bien vivir, as well as Pan-African feminist political thought. And both traditions remind us that health systems are not neutral. They reflect power, they reflect history, and they reflect those lives are prioritized and whose lives are treated as expendable. The indigenous cosmovision reminds us that well-being cannot be reduced only to service delivery. It is relational between people, institutions, and the environment. It is intergenerational, and it is rooted in dignity. It can also be separated from legal framework, nor it can be separated from racial justice, economic justice, or land sovereignty. At Libera, we work with midwives. Our work with midwives is rooted in a recognition that they are not simply service providers. They are essential architects of equitable health systems. We work along midwives, community providers, abortion companion, and clinical allies to build what we call an ecosystem of dignified care. And this model bridges historically disconnected systems, the formal clinical sector with the community-led networks, into a coordinated continuum of care, which is grounded in trust, in cultural ancestral knowledge, and in human rights. Through those partnerships, we strengthen referral pathways, we support providers with evidence-based protocols, and we expand access to essential care, even in highly restricted environments. Last year alone, through our partners, more than 10,000 women received dignified reproductive health services, demonstrating both the scale of the need, but also the power of community-rooted care systems that are led by midwives and frontlines providers. And this is where the PUSH campaign resonates deeply with me and with us at Libera. It is about political will. It is about shifting power. It is about moving institutions for the well-being of our communities. Midwives are at the heart of this transformation. They are often the first touch point, the trust provider, the trust friend, the bridge between health systems and communities, and the witness of the consequences of underinvestment, criminalization, and structural inequalities. And yet, many midwives operate within systems that simultaneously depend on their expertise and marginalize their authority. This reflects broader hierarchies, colonial legacies in health governance, patriarchal medical systems, and global financing models that privilege technocratic relief solutions over community-rooted technologies. At Libera, we believe in 3 strategies. First, we support strategic litigation to advance the implementation of regional human rights framework like the Maputo Protocol in Africa, as well as progressive institutional protections in Latin America. Second, we strengthen movements. So legal victories mean nothing without community power and real implementation. We invest in feminist lawyers and midwives and advocates and social justice leaders who are building locally rooted solutions. And third, we reframe power. We challenge global health architectures that centralize decision-making in the global north, while frontlines providers and communities bear the burden of implementing programs that are distant from their needs and realities. We question the systems that decide whose body are valued and whose body are disposable. This is about maternal health. It is about abortion access. This is about racial justice. It's about economic justice, because we should not treat them as separate conversations, because they are not separate realities. As we celebrate 1 more year of the PUSH campaign together, we push governments and philanthropy to fund midwifery as if they want us to win. We honor the knowledge and the contributions of midwives, especially the ones from the Global South, because we believe that another model of power is possible, one that is rooted in dignity, that is rooted in sovereignty, and that is rooted in collective liberation. And the work continues, and as we push forward together and always, I say thank you for the ICM and for the PUSH campaign and for the amazing work that you all are doing. Thank you so much.
Thank you so much, Anna, and thank you for reminding us of the power of collective action, of the power of, I'm really touched by your words that legal victories, and as much as we can push systems to change, it means nothing if it's not really rooted in the community and really shifting the power back to the people who build and use these systems, women, midwives. And really the importance of us coming together as an alliance to really challenge and disrupt these power structures that continue to strip people around the world of their dignity. Thank you to all the speakers of this inspiring panel for really helping us reflect and be re-energized. Many times I was feeling goosebumps by all of you. So I invite all of you to stay tuned for this next section of our event. I know we're a little bit over time, but we appreciate you staying with us. We will shift now from hearing the lessons learned, the successes of fellow advocates around the world to what now? What are the actions that we take now? So in the next section, our amazing colleague Ana Gutierrez will present the way forward. What are the actions that all of us can take as members of this community to drive change, to push for rights, women, and midwives? Over to you, Ana.
Hi, everyone. A pleasure being here. Such an inspiring conversation. Really amazing to hear what people are doing all around the world. And now I want to, we are already inspired, but I want to inspire you more with a couple of things we can do, easy and powerful ways that you can take action now. So let's move from inspiration to action into powerful steps. So the first one, this is the easiest one. I'm sure most of the people in this call have already done this, but in case you haven't, sign the push pledge. What does signing the push pledge means? Signing the push pledge is becoming a formal part of this community, and it implies three principles, which is to agree with the push principles, which are holistic care, evidence-based and inclusive services, respect for women's autonomy, partnership with midwives to uphold rights, and leadership that recognizes midwives and includes women in decision making. All principles that I'm sure all of us agree with, because if not, we wouldn't be here in this conversation. Then you commit to talking to people in your life about their right to respectful, empowering, woman-centered care. And you commit to acting locally and globally to demand woman-centered care and midwives. Super easy, super straightforward. Scan this QR code. You will be taken to the Push website. There you fill out a form. Once you fill out the form, you will get a really nice email from us with all the information you need to act. You can join our WhatsApp group in which we have multiple advocates from around the world who share content, share experiences, who are looking for others to support their causes. So first easy step. The step one has two parts. The second part is engage others to also be a part of this movement. Here you can see a picture of action that came out of the Advocacy Incubator, which is something that we're spotlighting today. You can also do this if you will get materials and assets that you can adapt to your local context once you sign the Push Pledge. And if you need anything else to promote it in your community, please send us an email and we will be super happy to help you do something big. And we move on to step two. So, multiple speakers have talked about the need for more midwives. So, there's a really straightforward action we can all take together to get policymakers to really pay attention to this need for more midwives. And that is to sign and share our global petition for 1 million more midwives. You can scan the QR code here. You will be taken to a very easy, very nice looking webpage in which you will be able to read all about the petition. I want to give you some background just for all of you who don't know enough about this. So where does this come from? This comes from a study that we did a couple of months ago in which we analyzed the midwifery workforce in 182 countries. And we analyzed the need that women and communities had in those countries compared with how many midwives were providing those services. It's a lot more complex than I'm making it sound, but I'm simplifying it. And the conclusion was that we're missing 1 million more midwives. And this is not in just particular areas in the world, it's everywhere. Almost every country is missing midwives, and absolutely every region is missing midwives in some way or form. If you want to read that really cool article, you can scan this QR code and you will be led into the actual paper that states the evidence behind our call for 1 million more midwives. So now about the petition. So now we have the need, and now what are we going to do about that need? We are calling on policymakers to do three very simple and straightforward things for midwives. This will not only engage more people to join the midwifery workforce and in turn make us not have as big of a lack of midwives, but it will also make the life of midwives who are already working easier, better, more respected. So what we want for policymakers to do is to invest in and recognize midwives and enable them to work to their full scope of practice, equip them with education, skills, and resources in supportive workplaces, and invest in leadership so that midwives can shape decisions and collaborate equally and equitably within the health systems that they work in. Our goal is to get 1 million signatures for 1 million midwives. We're not even close to what we're looking for, so we really need you to engage with this. What are we going to do with this petition? So we opened it back in October. We have continuously advocated for the petition to be out there. We're putting it in the media, we're putting it in podcasts, And we're going to take it to the ICM Triennial Congress in Lisbon to present it to policymakers with the final number of people who have signed. What is that number going to make? That number is going to create political pressure for policymakers to see the need of midwives and see the call of people asking for more midwives. And from them forward, we're going to enable all the member associations of the International Confederation of Midwives and all of the push champions to use the numbers from the petition to advocate in their local context. So that might be letters to your policymakers in which you say, in my country, we had 10,000 signatures asking for more midwives, and we need at least 2,000 more midwives here. And giving them the evidence so that they can actually act on what our communities need. So how can you support the petition? You can share the petition on social media using the hashtag 1,000,000more. You can share it on your WhatsApp groups, on your email, on your newsletter, Facebook, anything you can think of is a good way to share it. We need as much people as possible to know that this exists. For that, you can use all of our downloadable posters, graphics, the QR code. You can print them and post them at your work, local clinic, your school, your place of worship. And you can encourage the organizations or hospitals or clinics that you work for to get involved in it and promote the petition as well. For that, we have put together an incredible suite of things that you can download. If you scan this QR code again, I feel like I'm making you scan a lot of things. Don't worry, this presentation will also be available to all of you. You will get a folder with a series of assets, including a video, the QR code, a press release, some personalized graphics that you can use across multiple spaces. So some ideas of how people have shared it. You can add it to presentations that you're doing at congresses, at meetings like this one, at the school that you are working on or studying in. You can put it in your bulletin boards, in your building's bulletin, anywhere you can imagine. You can print it out and take it to the streets like our team did. You can post it on social media, or you can engage larger groups like this incredible midwife in Ethiopia who engaged all of his students to sign the petition with a huge poster. So there are two big advocacy opportunities coming up soon, making it easy for all of us to advocate together. The first one coming up really soon, and why we're all here together today, International Women's Day. This is this Sunday, and we know that there are marches, that this is different in every context, but that there are marches all around the world happening for women. And what would be of women without women's health and without midwives? Very little. So we need to advocate for midwives during International Women's Day. So we've put together a series of banners that you can print out and a series of ideas for posters that you can make at home if you do not have a printer, so that if you're participating in a Women's Day march, you can take these materials with you and engage other women who I'm sure will be interested in to learn more about this. It's the perfect place to talk about the health needs of women and women-centered care. And finally, the International Day of the Midwife, which is happening on May 5th. Anyone who's a midwife here knows that this happens on a yearly basis. Anyone who's not, welcome to the club. We celebrate midwives that day, and we use it to advocate for all that midwives do, and in this case, for 1,000,000 more midwives. We will be releasing the toolkit on the 16th of this month. That means in 2 weeks. And there you will have a series of social media assets that you can use, a press release, and a lot more that you will be able to use to further the call for 1,000,000 more midwives. So we don't just want you to sign this petition. Of course, that's the first step. We really want you to share it because we need to get to as many people as possible. So get inspiration by all of the amazing presentations we had today. Engage people in your networks. Engage that friend that you have who's a social media influencer. That friend you know who has a podcast. Tell her to invite you and talk about the petition and the need for more midwives. So I will put it back to Daniela. But thank you very much for everyone who's here and who's standing with us, even if we're running a little bit late.
Thank you, Anna, and thank you to all our ICM colleagues who have put together today's event. And thank you to all 142 of you who have been with us for just over an hour.
Today, as we celebrate Push's birthday and International Day of the International Women's Day, we have seen proof that advocacy works. We've heard how regional advocacy through the Regional Advocacy Incubator ignited concrete progress in Ethiopia, Kenya, and Uganda, where midwives are influencing policy, strengthening alliances with civil society, and advancing national agendas for woman-centered care. These aren't abstract ambitions. They're measurable steps towards systems that respect women and value midwives. We've also had the pleasure of traveling virtually across regions, from Guatemala to Portugal to the Arab states, where our push champions reminded us that this is really a global movement. Different contexts, different challenges, but one conviction: that woman-centered care isn't optional, and that midwives are essential to rights-based, equitable, and resilient health systems. Indeed, midwives are much more than just health providers. They're the building blocks of health systems and of woman-centered care. Marking 1 year since the launch of the Push campaign and days before International Women's Day, I'm feeling energy and inspiration to push back together with all of you. In a time when women's rights are facing escalating opposition, today has shown that we're not alone and that we're not silent. We're organized, we're evidence-driven, and we're united. But anniversaries and birthdays are not only for celebrations, they're also an opportunity to recommit. The shortage of 1 million midwives remains. Barriers to leadership and fair working conditions persist, and too many women globally still lack respectful, quality care. So I hope that today together we leave with renewed determination, all 140 of us. As Anna mentioned, and as my colleagues have put in the chat, sign the petition for 1 million more midwives. Encourage your friends and colleagues, neighbors, all the people in your life to do the same. Take the Push pledge and share it and sign it. Bring new champions into the movement. Share the evidence from midwives and how they deliver woman-centered care. Let's organize and show up for each other. And together, we'll continue to push for rights, for women, and for midwives. Thank you for staying with us a few minutes over. It's been our pleasure to host you, and enjoy the rest of your day.
Bye. Happy International Women's Day.